Okay, so this video we're going through the assessment of a newborn. As I go in and kind of chat with the parents, I usually start off my visits with, how are you doing? How is your night? I might ask them how they are generally feeling, but as far as the newborn's care, I usually start with how is nursing going or how is bottle feeding going. I might ask questions regarding like, how is their latch? Is it painful to you? How often has the baby been nursing for? How often in a session and how regular are they nursing? So are they nursing every hour or are they nursing every 4 hours? That usually gives me a general idea of how the baby is doing overall. And then I'll talk about wake sleep cycles. Are they awake for a period of time? Are they mostly sleepy? Babies that may have had a harder time being born might be a little bit more sleepy and take a little bit longer to come into their body. So it just gives me a general idea just by asking those questions. Then I review any concerns they have. And then I'll start my assessment. So first thing I do is I usually look at the baby. I make sure that their head looks normal, that there's no concerns, there's no cephalehematomas or anything like that happening, which did happen with my baby. So I'm very cautious and aware of that, to look at their head and see how they're doing. I'll always look in their eyes and their nose and their mouth and just kind of peek around, do a general assessment of the baby's skin to make sure there's no weird rashes or red spots or signs of infection or anything like that. I'm also paying attention to... You're all done? Okay. I'm also paying attention to if the baby has any yellowing of their skin and if there's any concerning signs as far as being jaundice. So I usually look at their skin and make sure everything appears normal there. And then I will listen to the baby's lungs. I will do respirations. I'll listen for a full minute and count the respirations to make sure that they're within normal range. I'll also make sure that the lungs sound clear and there's no crackling happening or any wheezing or anything like that for the newborn. And then I'll listen to the baby's heart rate and make sure, that everything sounds normal there, that it's a clear thub-dub heart rate and that there's nothing abnormal, no irregular sounds as far as their heart rate is concerned. And then what else will I do? You don't do a blood pressure on the baby, so I won't be performing that. Sometimes we'll do a pulse ox if my preceptor is with me. I'll do a pulse ox. And then I'll weigh the baby. So I'll always look at what their birth weight was compared to their weight from their last appointment or their last weigh-in compared to now, to ensure that the baby is continuing to gain weight and that everything appears to be really normal. If I am doing any type of metabolic screening, I'll warm their foot to do a heel prick test and get that ready. I'm trying to make sure I didn't miss anything. Mouth, lungs, heart. I'll pay attention to their tone to make sure that they have good tone in their body, that they're not just like super floppy and kind of lethargic. And I will also look at their bottom to make sure that there's no concerns. Or I might ask the parent, how many how many pee diapers have you been having? How many BMs has the baby been having? Do those appear to be normal? Are they normal in smell and color? Any concerning symptoms with their diaper that you're seeing? So we'll review that too. And I believe that is everything. I believe that's everything. And